Master the fundamental techniques of measuring vital signs, temperature, pulse, respiration, blood pressure, a critical skill for any healthcare professional. Vital signs are key indicators of a person's health and bodily functions. They provide healthcare professionals with valuable information about the body's basic physiological functions. These signs are crucial for diagnosing health conditions, monitoring progress, and ensuring patients receive proper care. Regular monitoring of vital signs allows healthcare providers to detect early signs of illness, manage existing conditions, and assess the effectiveness of treatment plans. 4 primary vital signs. 1. Temperature indicates the body's ability to regulate heat and its overall metabolic state. 2. Pulse, heart rate, reflects the number of heartbeats per minute, offering insight into cardiovascular health. 3. Respiration, breathing rate, indicates lung function and the body's ability to oxygenate blood. 4. Blood pressure, measures the force of blood against the walls of arteries, revealing heart health and circulatory efficiency. Role of healthcare professionals in monitoring vital signs. Healthcare professionals are responsible for accurately measuring and interpreting vital signs to guide patient care. This includes routine monitoring, emergency assessments, and ensuring that correct techniques are used to avoid errors. Now, we will discuss the temperature measurement. Here are the types of thermometers. 1. Oral thermometer, used in the mouth, most common for adults and children. 2. Rectal thermometer, used in the rectum, typically for infants or patients who cannot take oral readings. 3. Axillary thermometer, measured under the arm, typically used for infants or when other methods are not available. 4. Tympanic thermometer, measures temperature in the ear canal, offering a quick and non-invasive method. 5. Temporal artery thermometer, uses infrared technology to measure temperature across the forehead. Step-by-step guide to measuring body temperature. 1. Oral. Place the thermometer under the tongue, close the mouth, and wait for a beep or until the reading stabilizes. 2. Rectal. Insert the thermometer about 1 to 2 inches into the rectum, hold in place, and wait for a reading. 3. Axillary. Place thermometer in the armpit and ensure it touches the skin, holding for several minutes. 4. Tympanic. Gently pull the ear back and insert the thermometer, ensuring a snug fit. 5. Temporal artery. Gently swipe the thermometer across the forehead. Factors affecting body temperature. 1. Age. Children and elderly individuals may have slightly different normal ranges. 2. Environment. Extreme heat or cold can affect the body's ability to regulate temperature. 3. Physical activity. Exercise increases metabolic rate, leading to heat production and a rise in body temperature. Common units for recording temperature. Celsius and Fahrenheit are the 2 primary units. Be mindful of conversions. Example, 37 degrees Celsius equals 98.6 degrees Fahrenheit. Troubleshooting common errors. Inaccurate readings can result from poor technique, incorrect placement, or malfunctioning equipment. Always check the thermometer and technique before concluding a reading. Pulse measurement. Pulse is the number of heartbeats per minute, BPM, typically measured at certain pulse points in the body. It reflects cardiovascular health and can reveal issues such as arrhythmias. Here are the methods of measuring pulse. Carotid pulse, felt at the neck next to the windpipe. Femoral pulse, felt in the groin area. Others, brachial, popliteal, and dorsal pedis pulses. How to calculate pulse rate. Count the number of beats for 30 seconds, then multiply by 2 to get BPM. Alternatively, count for 60 seconds for an accurate measure. Factors affecting pulse rate. Medications. Some can lower or raise heart rate. Exercise increases pulse rate. Stress can either increase or decrease depending on the situation. Hands-on pulse measurement. Encourage students to practice on themselves or appear to feel the pulse at different points. Respiration measurement. Respiration reflects the body's ability to oxygenate the blood and expel carbon dioxide. It's crucial for evaluating lung function and overall health. Methods for measuring respiratory rate. Visual observation. Counting chest rises and falls for 30 seconds, then multiplying by 2. Stethoscope. For more accurate listening, use a stethoscope to count breaths for 30 seconds or 1 minute. Normal respiration rates by age. Newborn, 30 to 60 breaths per minute. Infants, 1 to 2 months, 30 to 40 BPM. Children, 1 to 5 years, 25 to 35 BPM. Adult, 12 to 20 BPM. Identifying abnormal breathing patterns. 1. Dyspnea, difficulty breathing. 2. Tachypnea, rapid breathing. 3. Bradypnea, slow breathing. The relationship between respiration and other vital signs. Changes in respiration often correlate with changes in pulse or blood pressure, indicating a possible underlying condition. Blood pressure measurement. Systolic pressure, the pressure in the arteries when the heart contracts. Diastolic pressure, the pressure in the arteries when the heart is at rest between beats. Instruments for measuring blood pressure. Manual sphygmomanometer includes a cuff, bulb, and stethoscope. The clinician inflates the cuff and listens for heart sounds. Digital BP monitors, automated devices that provide a quick and easy reading. Step-by-step procedure for measuring blood pressure. Step 1. Ensure the patient is seated comfortably with the arm at heart level. Step 2. Wrap the cuff snugly around the upper arm, just above the elbow. Step 3. Inflate the cuff until the artery is occluded, typically around 180 mm mercury. Step 4. Slowly release the air while listening for the first, systolic, and last, diastolic, sounds. Step 5. Record the readings in millimeter mercury. Significance of accurate readings. Accurate blood pressure readings are crucial for diagnosing conditions like hypertension, which can lead to stroke, heart attack, or kidney failure. Interpreting blood pressure readings. Normal. Less than 120/80 millimeters of mercury. Elevated. 120 to 129 over less than 80 millimeters of mercury. Hypertension stage 1. 130 to 139 over 80 to 89 millimeters of mercury. Hypertension stage 2. Greater than or equal to 140 over 90 millimeters of mercury. Understanding abnormal vital signs. Abnormal readings in any of the vital signs can indicate underlying conditions such as infections, cardiovascular issues, or respiratory problems. Recognizing high and low readings. Temperature above 100.4 degrees Fahrenheit, 38 degrees Celsius, suggests fever. Pulse above 100 BPM may indicate tachycardia, while below 60 BPM may indicate bradycardia. A respiratory rate over 20 BPM or under 12 BPM may suggest respiratory distress. Blood pressure over 140/90 millimeters of mercury may indicate hypertension. When to seek medical attention. Abnormal vital signs that are persistent or worsening should prompt consultation with a healthcare provider. Conclusion and recap. Vital signs are a critical part of patient care. Accurate measurement and interpretation of vital signs can help prevent serious health issues. The role of technology in vital signs measurement. Wearable devices and remote monitoring are making it easier for healthcare professionals to track vital signs in real time.